discussion on Ayurvedic concept of skin diseases. First, I'll discuss a few general concepts and then we can discuss about psoriasis in specific. So I will just share a PowerPoint presentation, share my screen with you. So as you can see here, beginning with skin diseases, Tvak Roga. Tvak means skin in Ayurveda. You already know about the anatomy of the skin. Just to revise, the 7 layers of the skin: Avabhasini, Lohita, Shweta, Tamra, Vedini, Rohini, and Mamsadhara. The 7 layers, Avabhasini is the outermost. Avabhasini basically means that which covers the outer layer of the skin that covers the whole body. Lohita is red, Shweta is white, Tamra is copper color, Vedini is that which deals with the pain sensations where there is a nerve endings which are seen. Rohini, blood vessels and lymphatics, and finally you can see, as in the picture, the lowest layer is the muscle layer. Each of these layers is connected to the 7 dhatus. The first layer is the rasa dhatu, second rakta, mamsa, and so on. In this particular type of disease, skin diseases, mainly begins with involvement of rasa and rakta dhatu, although the other dhatus are also gradually involved. In chronic cases, all the dhatus can get involved. Diseases of skin, as explained in the Ashtanga Hridayam, the types of disease described are Visarpa, Shvitra, Pandu, and so on, and 18 types of Kushta diseases. It's important to understand why Visarpa, Shvitra, Pandu are separated from the 18 types of Kushta. Basically, Kushta has got a certain type of samprapti, a pathogenesis, which differentiates it from Visarpa, Shvitra, and Pandu. And there are 18 types of Kushta, as we will see ahead. One of the important things to understand before understanding skin disease is the concept of Roga Marga. Roga means disease, Marga means pathway. The pathway in which the disease or the doshas travel, causing the imbalances. They are explained in Ashtanga Hridaya 12th chapter. I encourage you to go to the Ashtanga Hridaya and read about this and try to understand. The 3 Roga Margas or pathways are Bahya. Bahya means external. Abhyantara or internal, and Madhyama is the middle. The middle pathway, the internal pathway, and the external pathway. Some of these concepts are yet to be fully understood. I myself have discussed with many Ayurvedic Vaidyas, and their opinion is that these pathways are not just physical pathways that you would see at this time in the body, but they are more connected with the embryonic development classification of tissues. From the prognosis point of view, the pathways represent how deep the disease has gone into the body. The Bahya Roga Marga, as we know, diseases usually manifest within the koshta, which is the main site of the doshas, which is the Abhyantara, the internal Roga Marga. From the internal Roga Marga, as they start moving out, they go to Bahya, the external Roga Marga pathway. And when the disease is not treated, still they can enter into the Madhyama Roga Marga, making them very, very resistant to any kind of treatment, almost rendering them impossible to completely cure. So it's very important to know the Roga Marga in order to give the client a good understanding of whether it is totally curable or not and how to go about this. Before describing Kushta in Ashtanga Hridaya, the author has described about Visarpa. Visarpa is a very rapidly fast spreading skin lesion. It begins internally, goes outside and can affect the different dhatus. It's very rapidly spreading, but mainly affecting the Bahya Roga Marga. Foundation, Yadhisthana, is the Bahya Roga Marga. Kushta is a disease of the Madhyama Roga Marga. Kushta is a disease of Madhyama Roga Marga, and the foundation can be either in the Tiryak nadis, the channels connected to the Madhyama Roga Marga. We will see. For those who would like to know about what is Madhyama Roga Marga, Abhyantara Roga Marga, Bahya Roga Marga, a short description is Abhyantara Roga Marga is the koshta from the mouth to the anus, the gastrointestinal tract is the Abhyantara Roga Marga. Antak koshto Mahasrota, the Mahasrotas is the gastrointestinal tract, and that is described as the Abhyantara Roga Marga. Then the Bahya Roga Marga consists of Shakha Raktadaya Tvakcha, the Shakha, the periphery, Raktadaya, the Dhatus, Rasa Rakta Mamsa Meda, these Dhatus, and Tvak, the skin, consist of the Bahya Roga Marga. And the Madhyama Roga Marga, they consist of Shiro Hrudaya Vasti, the head, the heart, the urinary bladder, Vasti, Marmani. These are the three main Sadhya Pranahara Marma. You have studied about different types of Marma. These are the Marmas which can immediately kill a person within no time. And there are many other Marmas. The Marmani are also part of Madhyama Roga Marga. Then there is Asthnam, the skeletal system, the bones connect, and the Sandhi, the joints, the Siranam, the different arteries, veins, Kandara, the ligaments, and so on, form a part of the Madhyama Roga Marga. Sandhi Asti Trika Shula Grahadaya. So Sandhi, the involvement of the joints, involvement of the ligaments, involvement of the bones, the head, the heart, the bladder, they come within the category of Madhyama Roga Marga, which are very difficult to treat. Shvitra is a disease of especially disease of the Bahya Roga Marga. Visarpa is mainly connected to the Abhyantara Roga Marga. Shvitra is mainly connected to the Bahya Roga Marga. Visarpa goes from Abhyantara to Bahya, and it can progress into Kushta, which when it starts affecting the Madhyama Roga Marga. So Kushta is also described as an extension of Visarpa. Sometimes it is described in that way. Types of skin diseases. Classification according to dosha. 7 types: Vata, Pitta, Kapha. Vata Pitta, Vata Kapha, Pitta Kapha, and Tridoshik. Among these, psoriasis has been commonly classified by Ayurvedic Vaidyas in the Vata Kapha category, although along with the lesions, typical lesions in psoriasis, we can see certain, it is possible to see lesions connected to the other doshas as well. So we cannot totally confine an allopathic diagnosis into an Ayurvedic classification, because the way how it is classified in allopathy and Ayurveda are different. Although for conventional reasons, for the reasons of understanding, many Vaidyas have classified psoriasis as a Vata Kapha, but we should keep in mind that this is not exclusive. You can read more about this in Ashtanga Hridaya Nidana 14th chapter, 6th verse. A little more detail about this classification. Some of these names might be very funny, unfamiliar to you. I have deliberately included these names here just so that we can become familiar with these names. I would advise all of you to just read through these names and become familiar with them, and eventually to be able to classify the skin diseases that we see into these Ayurvedic diagnoses, and thus go into the management through this route. Yes, we know that there are the allopathic diagnoses, and that is good if we want to go into the management and treatment through the allopathic route. If we want to go into the management through the Ayurvedic route, it will be more helpful to understand the disease and diagnosis from the Ayurvedic perspective. So Vata dosha, the skin disease which is predominant in Vata dosha is called Kapala, Pitta dosha, Audumbara, Kapha dosha, Mandala and Vicharchika. Vata Pitta is Rishya Jihva. Vata Kapha, I have put it in red because that is where we are correlating psoriasis for now. 6 types of Vata Kapha disorders: Charma Kushta, Eka Kushta, Kitibha, Sidma, Alasa, and Vipadika. Kapha Pitta, Dadru, Shatarushi, Pundarika, Visphota, Pama, Charmadala, and Tridoshik is Kakanam. So these are the 18 types of Kushta, skin disorders, apart from Visarpa, Shvitra, and Pandu that we saw. Within these few diagnoses, Ayurveda has summarized or included, encompassed all the skin disorders that we can ever experience. Of course, there can be more subclassifications of each of these types, which have been done in other books like Arogya Kalpadruma and so on. And among these 18 types, there are certain types which are especially very resistant to treatment. They are called Mahakushta, which include the first three, Kapala, Audumbara, and Mandala, and Mandala. Then Dadru, Kakanam, Pundarika, and Rikshajihva or Rishyajihva. Rishya means deer and Jihva is tongue. Deer, if some of you have seen, the deer has got a tongue which is more dark in color, black tongue. So these lesions are very dark in color, hence they are called as Rishya Jihva. At this point, I would like to just take you quickly through these 18 types of kushta Before we actually go into the discussion of psoriasis, okay, so I would like to bring up and share another file with you. Just take you quickly through the Mahakushta, the different types of Kushta disorders, the dermatological manifestations of each of the Kushtas. Mahakushta, we begin with Mahakushta. This is Kapala Kushta, a Vata type of Kushta. Kapala basically means black mud pot. One of the meanings of Kapala, it has this dark and hard appearance, rough, and it has been correlated to some of the allopathic diagnosis, as you can see below, tubercular leprosy. Udumbara is a Pitta type of Kushta, coppery red in character. There is an Udumbara is a fruit which is coppery red in color. So it's been correlated with that. Mandala are specific round patches, whitish red in color, unctuous, itching, oozing, connected to more kapha type of skin disease. Aruna is again a red type of lesion. This has been mentioned only in Sushruta Samhita. It is also a Vata type of Kushta. Rishya Jihva is a Vata Pitta disorder. Pundarika is a Pitta Kapha. Sidma is Vata Kapha. We are especially interested in this particular type of skin disorder now. Tadru, Pitta Kapha. Kakana is Tridosha. And then there is Kshudra Kushta. The earlier one was Mahakushta, difficult to treat, and Kshudra Kushta, which is relatively easier to treat. Eka Kushta, which is Vata Kapha. Charma Kushta, Vata Kapha again. Mahakushta, Kaphaja. Kitibha, Vata Kapha. So some physicians, they correlate psoriasis with Kitibha. Vaipatika, Vata Kapha. Alasaka, Vata Kapha. Alasaka is correlated many times with lichen planus. Visarpa, sometimes correlated with erysipelas, herpes zoster, so on. Smallpox lesions, chickenpox lesions. Parisarpa, Charmadala, Pitta Kafaja. Pama, which is also Pitta Kapha. Scabies has been correlated with that, where itching is the most prominent, itching and exudation. Vispota, blebs of skin which come out and containing fluid bursts. Bulle, fluid filled, raised, translucent, which involves all the three doshas. Sthula Ruksha, Shataru, Rakasa, Vicharchika. Vicharchika is correlated with eczema. It is a kaphaja type of lesion. So, just wanted to share this with you so that you can have a general idea of these different types of skin lesions. Now we shall come back . and go back to our PowerPoint presentation. There it is. So from here we are going to focus a little more on the Vata Kapha type of disorders, because this is where most of the physicians try to correlate psoriasis. We saw 6 types of Vata Kapha disorders: Charmakushta, Ekakushta, Kitibha, Sidma, Alasaka, and Vibhadika. Charmakushta is where the skin is very rough and thick. Ekakushta is a large and wide lesion, very huge lesion, sometimes covering large areas of the body. Special characteristic is that there is no sweating. The rest of the skin will sweat, but just that part of the lesion, there will be no sweating. And it will appear scaly, like the scales of the fish. Kitibha is especially dry, rough, hard, itching, black in color. And it produces a characteristic type of sound, a typical kind of a sound while scratching. So basically, it's hard and itching. And some physicians have correlated certain aspects of psoriasis with Kitibha. Then there is Sidma, patchy lesions, dry outside and moist inside. Again, it can be very itching, smooth to touch, and can give out white flakes, small scales or white flakes on scratching, powdery, white or copper colored, reddish colored, and seen more on the upper part of the body. So Sidma is more on the upper part, according to Ayurveda. But that doesn't mean that it is not there on the lower part, it is more on the upper part. Alasaka, small tumor-like projecting outside, red-colored, itchy lesions. So some of the skin cancers could fall into one of these categories. Vibhadika, cracks and fissures in the hands and feet, especially seen on the hands and feet, severe pain, mild itching, red-colored eruptions. It will be really good if we can understand the skin cancers, carcinomas, from the point of view of Kushta, Visarpa, and so on, and do the treatment, the appropriate treatment. We might be able to get really good results. Why I say this is because not much work has been done in this direction so far. A lot of work needs to be done in Ayurveda. A lot of observational studies, documentation has to be done, which has not been done so far. So I would like to encourage each one of you to do these kind of studies and documentations individually or collectively for the betterment of this science. Going ahead, Nidana, Ashtanga Hridaya Nidana, 14th chapter, from the first verse to the third verse gives the causes of skin disorders. The number one cause that has been given is incompatible food, irregular lifestyle, Nityahara Viruddhahara. Nityahara Viharena Visheshena Virodhina. Visheshena, especially. The word Visheshena has been used to say that especially one may have a tendency, one may have a genetic predisposition towards acquiring a certain type of skin disorder, but that predisposition can manifest only when there is a favorable environment which is created for the disease through the incompatible food and lifestyle of the client. As long as we follow a strict regimen, proper Ayurvedic daily and seasonal regimen, In spite of having a genetic predisposition to a disease, the disease cannot manifest. It will remain in a seed form and will not fructify. That's a very important point because many of these diseases, they are incurable, and the best way to deal with them is prevention. And Ayurveda has a very clear understanding of how to prevent these diseases from occurring. It's just the lifestyle. We just have to follow the lifestyle and we can prevent them. Then we can look at the Nidana in the first chapter, 14th verse to the 18th verse. For every condition, I would request all of you to learn these verses by heart, to memorize them. The Nidana of Vata, Pitta, and Kapha vitiation, first chapter to the 14th chapter. I'm not going into the details of that because we don't have time, but they're really beautiful. I would like to just sing them for you so that you will be inspired to memorize them. तिक्तोषणकषायाल्प रूक्षप्रमितभोजनै धारणोधीरणनिशा जागरणात्युच्च भाषणै क्रियातियोगभिशोक चिन्ताव्यायाममैथुनै ग्रीष्माहोरात्रिभुक्तान्ते प्रकुप्यति समीरणः. That one was for Vata. The next one for Pitta. पित्तं कट्वं लतीक्ष्णोष्ण पटुक्रोध विदाहिभिः शरन्मध्याह्नरात्र्यार्ध विदाहः समयेषु च. Next is for Kapha. स्वाद्वं लवणस्निग्ध गुर्व हिष्यन्ति शीतलैः आस्यास्वप्न सुखाजीर्ण दिवास्वप्नातिबृंहणैः प्रच्छर्दनाद्यतियोगेन भुक्तमात्रवसन्तयोः पूर्वाह्ने पूर्वरात्रे च श्लेष्माद्वन्द्वं तु संकरात्. We have already discussed about the meanings of these verses in the previous sessions, so I'm not going into the detail, but please see these general causes of Vata, Pitta, and Kapha vitiation because you will have to identify these in your client and ask them to withdraw from these. And each of these causative factors for the dosha vitiation can be correlated to many different aspects of the present day lifestyle, and that will be a very wonderful exercise. And then panchakarma is also mentioned as a cause. Panchakarma is very popular these days, and many people may not realize that it is the panchakarma that is leading them into these skin disorders. So we should be able to identify what kind of, have you undergone any cleansing? What kind of cleansing have you done? So this is part of the history taking to understand whether they have undergone irregular or excessive or incomplete type of cleansing, especially the incomplete. Once the doshas have gone into utklesha, and if they are not eliminated from the body, then they stay in the body and can result in many kinds of skin disorders. And then comes the most important nidana of skin disorders is papa, sinful activity, offense to sinful or saintly, offense to saintly people. Not only saintly people, in fact, to any living entity. One should not be offensive. And this offensive mentality to exploit, to cheat, to steal, to kill, disrespect, insult. In the first chapter, there is the description of Dashavidha Papa, the 10 sinful activities that one can commit using one's body, words, and mind. This has a very significant role to play in the evolution of skin disorders. That's what the Ayurvedic acharyas say. And these may be either committed in the present life or it may be coming from some past life. So, to understand this, it is preferable to see the astrological chart from which we can clearly understand what kind of sinful activity was performed, what kind of sinful activity have we done in the past or our client has committed in the past to exacerbate or to trigger such kind of a skin lesion, skin disease. And the importance of understanding this is that there are certain remedies, prescribed remedies to counteract these sinful reactions, and one can engage in these remedies to become free from the skin disease. And we already said in psoriasis, look for Vata Kapha Nidana and Pitta aggravations. The general prodromal or premonitory initial beginning symptoms of Kushta, the very beginning, either the skin may become too smooth or too rough. Both extremes are possible. Sweating too much or no sweating at all. There could be some color changes in the skin which can be noticed. Burning sensation, itching, numbness, pricking pain, raised circular patches, becoming quickly tired on performing daily activities. And then one can actually start getting some lesions. Very quickly these lesions can form. They heal very slowly. They form quickly, heal slowly, very painful. And even after healing, they can leave behind a very bad scar. Why is the diet and lifestyle so important in Kushta? Because even a little deviation from this proper lifestyle can cause severe aggravation, and that too very quickly, just within hours sometimes. You eat something tonight which is not supposed to be eaten, the client eats something, and the next day, or sometimes within even the same day, within hours, they can have an eruption of this sudden aggravation of the skin lesion. So, horripilation, feeling goosebumps, and that kind of feeling in the body, and the color of the blood, which can become very dark. So, dark color indicates Shyava Varna. What is the color indicating? Dark color is connected to which dosha is it connected to? It is connected to Vata dosha. Black color of the blood indicates Ama, Vata, and so on. Vitiation of Rakta Dhatu takes place in the skin disorders. The full manifestation of each of these types of kushta, we very briefly saw them earlier in a file. I just quickly took you through these 18 types of kushta. And if you would like to read about them in more detail, I would sincerely recommend you to read them. Please refer to Ashtanga Hridaya Nidana, chapter 14, verses 13 to 30. The symptoms related to each of these 18 kushtas have been described. Now we come to the Samprapti, the story of pathogenesis. Kushta is very interesting, very peculiar in the fact that it can either originate in the koshta, as we said, due to incompatible foods, incompatible lifestyle, the dosha in the koshtas, either in the stomach, intestine, or the colon, can become disturbed, aggravated. Apart from that, kushta can also originate directly from the Madhyama Roga marg. From the Tiryak nadis, there are the nadis or channels which are going upwards, downwards, and sideways also. Tiryak nadis are those which are specifically connected to the Madhyama Roga Marga, referred to in this particular verse. And it is said that this papa or sinful activity actually creates a certain kind of energy change, which at a certain point of time automatically just vitiates the Tiryak Nadi. Nobody knows how, but it just happens at a certain time, and the doshas just aggravate in the Tiryak Nadis, and from there they travel outwards towards the skin. That is the initial pathway. They go into the skin and they show some of these small, simple changes. For example, we saw the skin can become either too rough or too smooth, stop sweating or a lot of sweating, some raised patches, some color changes. These things can happen in the beginning. And then a very peculiar feature of Kushta, which is not seen in any other skin disease, the doshas, after coming out into the skin, they do not break out, they go back in. They go deeper into the Madhyama Roga Marga, and one by one they start affecting the dhatus, rasa, rakta, mamsa, meda, asti, and they start putrefying them, they start disfiguring them, decomposing, eating up, destroying the dhatus, and eventually causing disfigurement. Eats up the dhatus and destroys the nadis, and the skin thus loses its support from inside, and it becomes flabby, it becomes wrinkled, it becomes sometimes stretched, or sometimes it can become very contracted, disfigured, discolored, and all these things happen. This is the story of Kushta. We can try to determine the dosha predominance of the skin lesion from these symptoms. Vata is ruksha, dry; parushya, rough; shosha, emaciated or becoming very thin; toda, pricking pain; shula, again pain; sankocha means the skin becomes contracted; ayama, skin becomes extended or stretched. When the skin becomes stretched, you can see that it becomes very shiny and smooth. Harsha, horripilations or goosebumps on the hair standing on end. Shyava arunatva. Shyava is dark discoloration. Arunatva is dark brownish red coloration. Pitta can be understood by daha, burning sensation; raga, again specific colors connected to pitta, yellow, red, green, and so on; srava, oozing; paka, which is suppurative lesion; visragandha, bad smell, bad odor, foul odor; kleda, excessive moisture; angapatana is feeling very tired, as we said, and a flabby texture, flabby nature of the skin. Kapha can be understood from shveta, whitish color; shaitya, cold to touch; kandu, itching. Wherever there is itching, we know that kapha is involved. Sthairya, the lesions can be raised from the skin, they can be hard, and very firm, not moving. Elevated Utseda, elevated raised lesions. Gaurava, a general feeling of heaviness in the body. Sneha, again, the lesions appear to be oily. There could be some oozing, oily feeling on touching. Kleda is moisture. And Jantubi Abhibhakshana, worm infestations can be seen in the lesions. Bacterial, viral, or any other kind of worms may tend to invade. That indicates a kapha lesion. Coming to psoriasis, let us quickly see from the modern perspective what psoriasis is all about. It's the modern, it's the most common autoimmune disorder in the USA. That's something really big. The most common autoimmune disorder. There are five main types: plaque, gutted, inverse, pustular, erythrodermic. I won't go into the details. This is just a picture of how the lesion looks like. One of the types of psoriasis. You can see the lesion of our client who we discussed, a lesion below his chest area, just below the nipple. Here is a quick summary of, at one glance, of the five types of psoriasis according to the modern classification. On the top, you can see the location of the lesions, and on the bottom, you can see the morphology of the lesions. Plaque psoriasis, which is the commonest, is seen on the elbow, knee, lower back, scalp, and trunk. And they are thick red patches with silvery white scales. I will not read through that. You can look at this table and quickly understand what each lesion is about. One can present with a mixture of these lesions. It's not necessary that it should always be a plaque lesion. A plaque lesion along with a pustular or a guttate, erythrodermic, or lesions which are very burning and exfoliative, large lesions which are seen in all over the body, big lesions spreading across large areas of the body are called erythrodermic and very rare to see. Just for our understanding, how does it occur? Modern medicine says that it is an autoimmune disease. And how does autoimmune disease happen? Nobody knows. It is just auto. Treatment in modern medicine, unfortunately, there is no cure. It is clearly mentioned in all the books that there is no cure. We can use steroids, cortisones to keep it under control from time to time. Whenever there is an aggravation and exacerbation, we can use the steroids to calm it down. But over a period of time, it gets more and more worse and stops responding even to these steroids. And what all the doctors, the skin specialists, they say is that the treatment of psoriasis does not really rely on medicines. Basically, it's got to do with identifying the triggers of the lesions and making the right choices throughout the day, the diet, lifestyle, and so on, to make sure that these lesions are not triggered. Prevention is the only way. That's what is explained. In the Ayurvedic side, is there a cure? Ayurveda classifies this type of kushta as an asadhya or incurable disease. There is sadhya and asadhya. As we described, the Madhyama Rogamarga, the diseases of the Madhyama Rogamarga come within the category of asadhya. But they are yapya. Asadhya are of two types. One is yapya, those which can be kept under control with proper treatment and diet and lifestyle. And there is those which are fatal, which cannot be kept under control and will eventually lead to death. But our skin condition, which is a Vata Kapha, psoriasis, is a Yapya condition. One can lead a completely normal life, but one should take regular supportive care, regular medication to make sure that the doshas are not going out of balance. Follow conducive lifestyle, dinacharya, ritucharya especially required, and regular counseling is required. Why? Because the tendency, this is a common human tendency, that when things get better, we feel that we can take a chance. And this is what I have seen in many cases, that when the client feels a little better, they start relaxing the guidelines, they start eating what they want, they start doing whatever they want, and then they trigger the lesion immediately. Within no time, they're back to square one. I still remember a patient, and I just can't forget, who was covered from head to toe with these white flaky lesions. They were falling out of his body. And I had gone to see him. I was working as a palliative physician at that time. He was just holding my hand and begging me, please do something to help. And unfortunately, I did not know so much Ayurveda at that time, and I was not in a position to help. I was feeling so helpless. So, this is how many physicians do feel when they come face to face with such kind of patients who are in such an exacerbated, aggravated condition. They just feel so helpless that there is nothing we can do. But there is a lot we can do with Ayurveda. Most of these patients have a tendency to be very irritable and to be very impulsive as well. Counseling is especially important for them, to convince them, to discover the underlying stress factors, to convince them about the importance of dinacharya, ritucharya, to from time to time remind them, yes, you need this, that's the only way that you can keep this under control. Hence, constant encouragement and discussion is required. The treatment principle in Ayurveda is puna puna shodhana, repeated cleansing, especially if there is bahudosha, till the time the aggravated doshas come back to normal, whether it is once, twice, thrice, four times, whatever it may be, repeated cleansing till the aggravated doshas have been eliminated from the body is vital, very important. And then one can go on maintenance therapy. So where kapha is predominant, vamana is required. Virechana is very good. If this connected to vata, it is a snigdha virechana. If it is connected to kapha, it is a ruksha virechana. Snigdha is unctuous type of virechana. Ruksha is more dry type of virechana. The rakta dhatu, being the vitiated dhatu, the most vitiated dhatu, rakta mokshana, bloodletting, becomes a very important part of this treatment. There are two types of bloodletting. One is the venesection, which is called Siraveda, and the next is using leech or Jaluka, leech therapy, where the leech sucks out the vitiated, corrupted blood. Lepana, different types of Ayurvedic ghees, herbal pastes, and so on can be applied on these lesions. Dhara, using herbal decoctions and other Ayurvedic medicines to pour, especially Takradhara is used, where buttermilk is poured either on the body, the whole body, or on the head to correct the Vata Kapha lesion. Especially Takra, buttermilk is Vata Kapha pacifying. Then Ayurvedic oils to be applied, medicated oils to be applied regularly as massage. Tikta Kashaya Ushna Virya, Rasa Rakta Prasadaka. Tikta, bitter, astringent, Ushna Virya for Vata Kapha again. Rasa Rakta Prasadaka, to balance the dhatus, especially Rasa and Rakta, and a general protocol of Kushta Chikitsa, as we will see. And Find out which is the dosha predominant and customize the treatment and the medicines used for all these different cleansing therapies according to the doshas that is involved. General protocol chikitsa is shamana, shodhana, prayaschitta, dinacharya and ritucharya, pathya, apatya, and the home remedies. Prayaschitta is the atonement, the procedure for atonement for all the sinful reactions to cleanse the mind, the body, and the soul from all the sinful reactions which are causing this particular skin disease. Pathya and apatya are the do's and the don'ts which help to prevent. A part of the dinacharya and ritucharya. Shamana is pacification treatment and shodhana is cleansing. Shodhana begins with snehana, oleation, snehapana, application of body abhyanga. Then there can be mild sudation, not too much because Rakta Dhatu is involved. Rakta is connected to Pitta, so we don't want to aggravate the Rakta Dhatu by too much steam or heat. Mild sudation is possible just to get the doshas out. Vamana is emesis, which is most commonly done in psoriasis. Virechana, purgation, to get the doshas out. Vata, Pitta, Kapha. Rakta Mokshana, bloodletting, as I described earlier, Sira, Veda, and Jalauka, two types of bloodletting therapies, and Takradhara. These are the Shodhana therapies. Pathya and Apatya, the do's and don'ts. Most important is to be always calm. And the best way to be calm is to learn how to breathe properly. I know many patients who have cured themselves of psoriasis just by learning how to breathe properly. Avoiding certain foodstuffs like yogurt, black gram, chilies, and so on. Salty foods, sour foods, acidic, which aggravate the rakta. And incompatible foods like fish and yogurt and so on. Cold and hot and cold foods mixed together. Cooked and uncooked foods. Eating foods which are not properly cooked. Not eating at proper time. So all these things have to be avoided. Excessive eating. Suppressing the natural urges. We already know the 13 natural urges. So one should especially educate the client in avoiding any kind of suppression of natural urges, because they may not be aware of the connection of this suppression of the natural urge. For example, especially it is said the suppression of the vomiting urge, nausea. If one has some kind of nausea, one should not suppress that. If one has, to call for nature, to pass stool, urine, yawning, because this kind of suppression aggravates the vata dosha and results in further aggravation of kapha and pitta. Immediate cold water bath after exertion, we come out from the hot sun and then we take a cold shower, that kind of thing. Or suddenly we come out from the cold and we take a hot shower. Those things should be avoided. They're all part of the dinacharya and ritucharya. Stressful activities, irregular schedules, improper sleep, and so on. Some of the things which can be helpful is to avoid any chemical irritant soap. Garlic, ginger, cumin, turmeric, these are all kitchen herbs which can be used in so many ways. Just it is recommended, if it is established vata kapha pathology, to just chew some garlic every day in the morning, fresh garlic. Just take 2 or 3 pods and chew it. Nowadays, we also get garlic tablets, so one can actually take them in the form of tablets as well. Ginger, cumin, these can all be judiciously used in the diet. Kakamachi, Solanum nigrum, the leaf juice of kakamachi is very helpful in reducing the lesions. Jasmine flower extract is very soothing. Blood purifiers, neem and turmeric, our client is already taking them. So this is very helpful. Neem can be also taken in the form of oil. Turmeric can be taken in the form of turmeric milk. Avoid pricking or peeling the lesions. Wear soft clothes to avoid irritation, and Vata Kapha pacifying oils. Mud therapy has been found to be very useful. This is very common in naturotherapy, covering the body with certain type of medicated, with certain type of mud which has got a medicinal effect. Very brief exposure to natural sunlight just to nourish. Using moisturizers, the best moisturizer is to use a Vata Kapha pacifying medicated ghee. For example, Tiktaka Ghritam, Maha Tiktaka Ghritam, so on. Breathing exercises and yoga, one cannot overemphasize this at all. Breathing exercises alone have produced tremendous results in patients of psoriasis, and certain selected yogasanas to complement them. Regular walking, especially after a meal, to make sure that the food is properly digested. Proper dinacharya and rutucharya. How can we emphasize this too much? It cannot be emphasized too much. Dinacharya and rutucharya, no matter how much we emphasize, it is less. So it is very important to educate each and every patient, each and every client about dinacharya, rutucharya. Understand by sitting with them what are the factors that they are. And as in this particular patient, a lot of counseling to increase the sattva, the manobala, the confidence, the determination. These are all uh, these are all symptoms of sattva guna, which have to be inculcated or developed or cultivated. Application of vitamin D in the form of oils or internal moisture, irritants, avoiding irritants, proper diet, Epsom salt bath has all been found to be quite effective as home remedies. Prayaschitta, meditation, chanting mantras, observing vows, charity, and so on. There are specific prayashchittas, specific atonements mentioned in some Ayurvedic books. One of them is Veera Simhavalokanam, where it is described in detail what is the type of activity that led to this particular condition, which can be understood from the astrological chart, and one can engage in those particular activity to neutralize that sinful reaction. Now we come to Shamana. I will not go into the details of discussing each of these herbs, but I have given you a list of herbs which you need to understand. You need to make a study. This is the homework for you. I have done it for one herb, Khadira, Raitia tinctoria, Aragvada, Tuvaraka, Madusnohi, Bhallataka, Manjishta, Trifala, Kushta, Vacha, Haritaki, Ashwagandha, Patola, Kakamachi, Nimba, Katuka, Trayamana, Musta, Bhunimba, Pippali, Amrita, Kantakari, and Haridra. These are the common herbs that I have found being used by physicians in practice to deal with this kind of skin disorder. I have done one herb for you just to help you understand how you can study these herbs. Khadira, which is a very useful herb in this type of skin disorder. Vata Kapha pacifying, Kapha Pitta pacifying, in fact, sorry. It's Guna, Rasa, Vipaka, Virya. I would encourage all of you to study these herbs in this particular pattern one by one, slowly, so that you can get a beautiful understanding of how in which specific condition we can combine these herbs. Shamana can also be done using combinations, different types of Ayurvedic formulations. Kashaya is a herbal decoction, Arishta is an alcoholic preparation, Churna is powders, Lepa is Ayurvedic paste or applications, skin applications, Gulika is tablets, Thailam is oil, Lehyam is licking type of jam preparations, and rasa is organometallic compounds. So I will not go into the details of each of these. If any of you have any doubts or any questions regarding any of these preparations, please feel free to write to me. I will be very happy to assist you in understanding these. Again, for your understanding, I have done one preparation, Amritottaram Kashayam, the dosha effect of the medicine, the dhatu effect, agni effect, mala, srotas, what kind of roga or what kind of pathology does it deal with, and what are the ingredients. So in this way, you can study the other, all these other Amritottaram, Arakvadadi Kashayam, Arakvada Amritadi Kashayam, Tiktakam Kashayam, Uluchyadi Kashayam, and so on. These are the names of the different medicines which are most commonly used and prescribed in Ayurvedic management of psoriasis. They can be used to take internally, they can be used to wash the body externally, they can be used to boil water and take herbal baths, and so on. Even to put it in the bathtub and have the client lie in the bathtub. Arishtas. So I have given a list of churnas, lepa, gulika, taila, gruta, lehya, and rasa compounds which can be used for dealing with this particular situation. Especially you can see that Andrea had spoken about Arogyavardhini Vati and Kamadugharasam. Arogyavardhini Vati is a tridoshik balancing disorder, especially for neutralizing the toxins in the body, increases a very strong Pachana effect. It is it corrects all Vata, Pitta as well as Kapha disorders, clears the Srotas very nicely. So when the nadis, when the Tiryak nadis are affected in the Kushta disease, skin disease, Arogyavardhani Vati is especially helpful. She also talked about Kamadugharasam, and which is mixed with pearl, moti, especially very good in Pitta type of disorders. When there is Pitta Anubandha, Pitta predominance, Kamadugha will work very well. So in this way, I would like you to study each of these preparations. And Kamadugha has a very good Rakta Prasadaka, that very good nourishing, balancing effect on the Rakta Dhatu. So when Vata dosha is predominant, one should understand that the foundation, the Adhara, the Adhisthana is in the Tiryak Nadis. When the Pitta symptoms are more prominent, one should understand that the Adhisthana is in the Rakta Dhatu. The Adhisthana of the disease or the Roga is in the Rakta Dhatu. When the Kapha symptoms are predominant, one should understand that the Adhisthana is in the Rasa Dhatu or the Lasika, and accordingly one should try to classify them and choose the right herbs, the right lifestyle, and the right formulation for dealing with this particular disorder, and also give repeated cleansing from time to time, the seasonal cleansings, the proper dinacharya, the daily cleansings. And if one does that, then one can successfully manage this type of skin disorder and help the client to lead a perfectly normal life. So I will stop here. Once again, I would like to thank all of you for joining me today, and I hope that you have got some useful tips, useful points that you can take away and further develop yourself, your own thinking. You can, which will help you to also go back into the classical texts, which will encourage you to do that, because that is my whole purpose, to not to make you dependent, but to make you independent, to help you think independently, to make you more, more, uh, to encourage you to take more effort to study and go into these scriptures and understand authentically, diagnose Ayurvedically, and treat Ayurvedically. All these preparations that you have mentioned are available. If any one of you have any difficulty understanding them or getting these preparations, you are free to contact me. Email is drsanjay at purnarogya.com. Dr. Sanjay at purnarogya.com. You can reach me on Facebook, of course. So once again, thank you very much and have a wonderful day. Bye bye.